Dr. Otero from A Plus Pediatrics, and I'd like to talk about one of the most common complaints today. What we see in our office is fever. Any type of pediatric fever is a cause for parents to get very concerned because it is usually a sign of there's something wrong with my child, whether it's a viral illness or a bacterial illness. It always tends to be scary, especially if it's your first baby, and it's definitely one of the most common things that we see here in our office. The first thing I'd like to say is, what's the definition of a fever? And a fever, medically speaking, is a temperature of 100.4 or greater. There are different ways of taking temperatures. You can take a temperature rectally, which is one of the things that we recommend most for babies that are under 2 months old, and a lot of times for any baby that's under 6 months old, because it is the most accurate temperature reading that we can see in a child. The next form, which is one of the easiest forms, is to take a tympanic temperature, and that's your typical ear thermometer, which does give a pretty accurate result as long as you use it correctly. And if you do not know how to use your ear thermometer, please bring it to the office. We'll be more than happy to show you how to use it. The other form is orally. Of course, the problem with orally, it has to be under the child's tongue and it has to be there for a few minutes. So sometimes that becomes more of a problem. Another form which we don't recommend too much is the axillary temperature. The thing about axillary temperatures is that it can be off by 1 degree, and sometimes it's accurate, sometimes it's not accurate. So this is where you find people saying to go ahead and add a degree, which we typically don't say to use. What I usually tell people is, if you have an axillary temperature of over 99.5, you may want to go ahead and do a rectal temperature or an ear temperature just to verify it. There are those new temperature things that can measure on your forehead. They're called temporal thermometers. However, these tend to be a little inaccurate depending on the technique that you use. So I typically say it's best to use the ear thermometer for bigger children that are under age 5 but over about 4 to 6 months. When is a fever concerning? I always get that phone call. What temperature am I looking for to go to the emergency room? And to be honest with you, the most important thing is, how does the child look? Because you can have a child with 101 temperature who is very sick. They can be lethargic, throwing up, dehydrated. I would be more concerned about that child with the 101 fever than the child with the 104 fever who's running around the office and having a good time, which we honestly do see sometimes. So it's not so much the height of the fever, but it's more so what the child looks like as well. If the child is drinking well, and if they're somewhat active, then we say it's okay to really treat them at home and they don't need to go to the emergency room. But when in doubt, anything over 104, we will likely tell you to go ahead and take your child to the emergency room. And the fever doesn't necessarily vary by age. However, if there is a child under 2 months of age, those children with any temperature must go to the ER immediately. The last thing I want to talk about is febrile seizures, because everyone thinks if my child has a high fever, they're going to get a seizure. But febrile seizures really only occurs in a small percentage of the population, less than 10%, and your child will be prone to the seizure regardless of the height of the fever, whether it's a 101 or a 104. If a child is already genetically prone to getting febrile seizures, they will get a seizure. However, we still want to keep all children, whether they have a risk of febrile seizures or not, we would like to keep them all comfortable. So of course you do want to use ibuprofen and acetaminophen, and our office can provide you with the doses. You can always call our nurses station, or we can actually give you a handout when you're in the office. So please feel free to ask for those, and they go all the way up to age 12. And any question that you may have regarding your child's fever, please feel free to contact our office. Thank you.